Hi there, my name is Rob Brunel. I'm an emergency doctor in Victoria. I work at the Royal Jubilee Hospital and Victoria General Hospitals. I'm just sending out a message to my family physician colleagues to express my gratitude for the care that they provided the community, as well as my concern about the current crisis that we have in primary care in our community. My emergency department colleagues and I are seeing more and more cases of advanced and preventable illnesses in the members of our community that is directly due to the lack of ongoing longitudinal care in the community by family physicians. We're seeing complications related to poorly managed diabetes. We're seeing attempted suicides in the setting of unmanaged depression. We're seeing advanced heart failure, and increasingly in the past months to year, more and more cases of metastatic cancer that's tragically picked up in the emergency department. These cases could be prevented by long-term relationships with family physicians where screening tests are done, the subtle clues that a cancer might be developing are caught. A lot of patients are accessing episodic care from walk-in clinics and urgent care centers. This is sufficient for some conditions, but does not replace that long-term relationship with someone who knows the patient's health history, knows the family history, knows what tests have been done, knows the various psychosocial contributors to health. This can be achieved only with long-term care by a provider who knows the patient well. So I very much hope that solutions can be found because this is a significant problem and we're seeing the fallout in the emergency department increasingly. So thank you for what you do. We support you and very much hope that some solutions can be reached. Happy BC Family Doctor Day.
Hi there, my name is Dr. Corey-Lynn Grabowski. I'm a specialist in physical medicine and rehabilitation. I essentially deal with patients with chronic pain and disability. I've been practicing on the island since I graduated from residency about 14 years ago. The landscape of medicine has changed drastically since I've been in practice. I'm not exaggerating when I say I feel like I'm sometimes practicing in a third world country. The lack of patient access to family doctors is hitting an absolute crisis point. As a specialist, I've been greatly impacted. My wait list, which used to be 6 months, is now between 18 months and 2 years. I can't fit in new patients. Patients come to me, they have numerous questions, need prescription refills for medications that I'm not comfortable prescribing. Patients are asking me many questions about lots of different conditions that I'm not completely familiar with because it's not my area of expertise. These patients are absolutely desperate for care. I have had many patients break down in tears as that they simply cannot access primary care. I find that I sometimes will order a test and an incidental finding will come up and it will be completely unrelated to my area of specialty, and I don't know what to do. Without primary care for backup, I am desperately seeking help from other specialists, and this greatly detracts from my ability to care for my patients. I am often burdened with paperwork for long-term disability, even driver medicals, and don't have comprehensive information about the patient on how to adequately fill this out. Family medicine is the cornerstone of medicine. Without them, nothing works. Specialists cannot function without our family medicine colleagues. We need to realize the breadth of care that they provide for our patients. The breadth of knowledge that they have is absolutely astronomical, and they are burdened with such responsibility. This crisis affects me every day. I have patients every day asking me if I know of any family doctors that will take them on. I work down the road from a walk-in clinic, and I'll often see a 95-year-old gentleman standing out in the rain holding an umbrella for his 93-year-old wife just to get their medications for their diabetes renewed. What kind of preventative care are we doing? I greatly worry about diagnoses that we are going to miss because routine screening tests are not being done. and this is going to affect generations to come. The cost of the medical system is only going to go higher. I beg the government to take this issue very seriously and please try to come up with a solution. Thank you very much.